Sorry, Senator, could you please
So just a
repeat the
review of the
question?
Life-Saving Drugs Program.
The review
what's
of
the
it?
update? Yep.
Sorry, Felicity McNeill, First Assistant Secretary, Pharmaceutical Benefits Division, Senator. That is still being progressed and a decision on that is imminent.
Is imminent?
Yes.
Okay, so you've got nothing else to say on that except the decision is imminent?
Yes,
okay.
Senator.
Can you tell me about the Life-Saving Drugs Program, the last change after review in 2009 inserted the word substantial and basically meaning that, you know, a drug would need to demonstrate substantial life extension, which I still can't understand what that means. Can you give me some clarity about what substantial means in the context of the Life-Saving Drugs Program?
Senator, that is a decision that is made by the clinicians when they assess the clinical evidence that's put forward for a particular drug. Since that change in the criteria for the Life-Saving Drugs Program, we have had drugs listed under that criteria.
What are the factors you consider when you're assessing whether substantial life extension
Senator,
occurs?
that is not assessed by me, that's assessed by medical practitioners. I'm but a mere humble public servant.
But they must have some guideline about what they, because I mean what I consider as a medical practitioner is substantial and what one of my colleagues who's also a medical practitioner might consider as substantial would vary wildly. So what is the sort of, what's the framework they use to assess that?
Senator, the guidelines for assessment of the Life-Saving Drugs Program are, as you've seen and it's quoted, that are published on the internet. That is then used as the basis of a submission that is put together by a drug company, by their health technology team. That is then assessed by the university assessors. That is then provided currently to the Pharmaceutical Benefits Advisory Committee, which comprises 18 members, many of which are experts in a variety of fields, also has consumer representatives, and that's why we then have a balance of views from the medical profession as to the evaluation of that evidence and whether the submission that is put forward meets that criteria. And as I've pointed out earlier, Senator, we have had drugs listed on the Life-Saving Drugs Program under that criteria since it was introduced.
That's right, and you've had drugs that also haven't been listed, and I'm just trying to determine why some are determined, you deem some to give a substantial extension of life while others are not, and I can't see any rationale for those decisions.
And Senator, those drugs have also not been recommended for the Life-Saving Drugs Program under the old criteria as well.
Yes, no, that's correct, but I'm asking you under the new criteria, what is it that makes one drug, how is it that one drug is able to demonstrate substantial extension on life and another drug doesn't?
Senator, the recommendations that are put forward by the Pharmaceutical Benefits Advisory Committee are published in public summary documents. All analyses that they've done of all drugs that have sought listing under that program are publicly available on the internet. The reasons for the evaluation of that evidence, the reasons for reconsideration of that evidence, and what evidence they're looking for in the future to reconsider those drugs.
Can I ask you about the review that's being done at the moment? Has there been any comparison to the way life-saving drugs programs work in other settings internationally?
As I said, Senator, a decision whether to proceed with that review is imminent.
So you don't want to speculate, or you don't want to confirm, or at least you don't want to reflect on the process that was used to arrive at that decision? Was some international markets considered as part of that review?
Senator, that's a matter for the government to determine if the review should proceed and what the terms of reference of that review should be.
If the review should proceed?
And that
I
is a
thought
matter
so.
for
The decision's not about the outcome of the review?
No, Senator, it's whether or not the review will proceed.
Okay, so the review was announced, I think, by the previous government. Is that correct?
That's correct, Senator.
And it was underway?
No, Senator, they announced their intention to undertake the review. In the process that had been agreed with Medicines Australia, draft terms of reference were provided to stakeholders in consultation to determine whether those were appropriate. That feedback was then provided. Some additional work was done. Those terms of reference are now provided to government, and it's a matter for the new government to determine whether or not that review should proceed.
Well, start. I mean, if you talk the terms of reference, effectively all we've got is some terms of reference. Is that right?
We had draft terms of reference, Senator.
Okay, so the government has some draft terms of reference and is going to make a decision about whether the review should be initiated.
That's correct,
Is that
Senator.
correct? Okay.
We had draft terms of reference, I think, when we were talking about that, the last estimate, so it hasn't from there?
Whether a decision to proceed
Well-
with the review, no, that hasn't, but work has been done on those terms of reference since that time, Senator.
So are the terms of reference complete? And have they been provided to the minister? Where is it up to?
A decision on whether to proceed with that is imminent, Senator.
Okay.
So the draft terms of reference with the minister.
It's now at a decision for government stage, Senator.
And so can I ask you about, in terms of the decision, should a decision not to proceed be made? Effectively, we're left with the status quo, which is that we have this substantial life extension clause in the current process. Is that
Senator,
right?
this is all in the it's a decision for government category, but there's really not a lot more we can say.
Well, if the decision, if the government decides not to proceed with the review,
Well,
then with the
government
status
can
quo.
do anything it wants in terms of changing criteria or proceeding with the review or whatever. It's essentially now over to the government.
All right. Well, it sounds like it's imminent.
It is
So
imminent.
there's probably not much point wasting any more